I think that the organisers today have played a bit of a blinder, because it means now that at least a section of this conference will be leaving here with a big smile on their faces, because as we draw to a close, it's time for some awards. So I'd like to invite Professor Kieran Walsh, Director of Health and Care Research Wales, to guide us through this final section. Welcome.
Thank you very much, Owain. Follow that. My mum's living with dementia, and I just found that so touching and so moving and so like our own experience. So I'm going to gather myself and say the final session today of the conference is in many ways, it connects with what I said at the beginning of the conference, that this is all about the people who do research, who are involved in research, who are engaged. And the final session, we have, I think it's 8 awards, and it's an opportunity to kind of recognise the best, express appreciation, celebrate people's achievements, and recognise that what people are doing who are in this room, and many who are not in this room, makes a difference to people's lives. We had a record number of submissions this year for our awards from all over the research community, and they were of a really high standard, which has made the job for our our judging panels, which I've not been involved in at all, and which have a membership that's multidisciplinary and includes, as I'm sure you'd expect, researchers, but also members of the public involvement community. The task they've had has been a really tough one. So as I said, we've got quite a number of awards, and for each one, I'm going to say a little bit about the award, and I may have some runners-up or particularly commended examples that I'll mention, and then I'll come to the winner and invite the winner to come down, receive a certificate, and get applauded, and all of those sorts of things. That's the plan. Quite appropriately, we're going to begin with the Public Involvement Award, which recognises the best use of public involvement in health and social care research. The panel were looking for examples that had been guided by the national standards for public involvement, which have been developed, and that's been developed by people leading from Wales in those UK standards, and looking for research that had really involved members of the public right through the research process. And there was a really great set of nominations, so I've got 3 special mentions I wanted to mention, 3 projects I wanted to give a special mention to. Ashrakanam and the Here Too study, looking at how the interpretation needs of adult asylum seekers and refugees in Wales are met in primary and emergency care, gets a special mention, as does Alicia Newman from Cardiff University for the work on developing a public involvement impact reporting tool, again using the UK standards, and Natalie Joseph-Williams from the Health and Care Research Wales Evidence Centre in Cardiff University for the work they did during the pandemic on bringing research to bear on really important and pressing policy questions. So 3 special mentions. I also have a runner-up in this category, and that runner-up is Martina Smubuovda. Oh, I've really scrambled your name there. I do apologise. And Nina Jacob, both of whom are from the Centre for Trials Research at Cardiff University for their project, Talking Trials. Talking Trials was funded by UKRI, and its purpose was to engage people from minority ethnic backgrounds in a really rigorous and in-depth discussion about how to make research inclusive and to address health inequalities for underrepresented groups. I've got a quote here from the judging panel I'll just read. This project really demonstrated how excellent communication using novel engagement methods can really make a difference and enable a two-way conversation. The time spent for genuine relationship building with these communities has enabled the project to evolve in a really positive way. So a great field, and in that context, I think all the more congratulations, therefore, to our overall winner of this category, and that is Fiona Leggett and Carol Rowe, a public contributor for the Centre for Trials Research LISTEN study. LISTEN is the long COVID, personalised, self-management support, co-design and evaluation project. And the judges said, this project had really meaningful public involvement right from inception all the way through to its conclusion, with very clear articulation of the 6 UK standards for public involvement, real focus on the support that public members who were involved were given and how their learning was incorporated as the project progressed. This project had the public at the heart of it. And they've demonstrated they really did listen to what they had to say. Now, Fiona and Carol can't be here to collect it, but I think Fionn Davis is going to come down to collect the award on their behalf. And I think we've also got a short video whilst Fiona's coming down. Oh, I think we should applaud.
Public involvement has been at the heart of the Listen project since the project's conception. We've evaluated some of this involvement and had the following graphics created. Now I'm going to hand you over to Carol. Carol is one of our public contributors who has worked on our co-design and involvement group.
Personally, I've benefited in many ways. The importance of feeling heard for a change and feeling useful again. I've also learnt things about my condition from other sufferers that help me in my daily life. The regular meetings and correspondence, being kept informed, being treated as an equal, being involved, the opportunity to speak to the media, to speak today, to speak at a conference, have all boosted my dignity and confidence at a time when they were at an all-time low. Involvement in the Listen project has been a very positive experience for me.
Okay, I'm going to move on to the Impact Award. And the Impact Award is, well, it's about impact, isn't it? It recognises the difference that research is making to people's everyday lives, and I'm going to go straight to the winner for this award. So the winner for the Impact Award is Ashra Khanum from Swansea University for the Here To study, mentioned already in dispatches, funded with a Health and Care Research Wales Research for Patient and Public Benefit Award. This study is really moving forward to make a difference to the experiences of asylum seekers and refugees who need interpretation in order to access primary and secondary care. And again, I've got a great quote from the judging panel. This is what they said. The topic of this research is so important as global crises and problems increasingly force people to seek sanctuary. Working at the interface between social care and healthcare, this work's making a real difference to improving lives, experiences and outcomes for this very disadvantaged group. And the judges were also, as noted already, really impressed by the quality of the diversity and inclusion within the teams and in the public involvement by the study. There was really clear engagement of stakeholders across the research piece, especially around policy development, and it built on a previous body of knowledge to develop outcomes, and it will further inform practice for other groups, not just asylum seekers and refugees who are affected by issues of language and communication. So brilliant, well done, Ashra.
Hello, my name is Ashra Khanum. I was a co-applicant and PPI lead on the Here To study, which investigated how well interpretation needs of adult asylum seekers and refugees in Wales are met in primary and emergency care. The study followed on from the first Here study, where people seeking sanctuary, NHS staff and third sector organisations told us that language needs and availability of interpretation services was seen as a barrier to accessing timely healthcare. The study was a great example of co-production and cooperation with people seeking sanctuary, Public Health Wales, academics, third sector organisations and interpretation services. The study was completed in 2023. Since then, we have had a positive response from policymakers in the Welsh Government who are keen to build on the recommendations from the study. A policy group was convened, including members of the Here To team, to implement the recommendations of Here To, which will contribute to standards for accessible communication and interpretation for people seeking sanctuary and other groups, including people with sensory disabilities.
I'm going to turn to a new award this year. It's the Innovation in Practice Award, which recognises innovation and the value that teams and individuals make in their fields of practice. I've got two highly commended entries that I want to mention from the judging panel, and then I'll come on to the winner of the Innovation in Practice Award. So the first highly commended one is from Kendall Smith, who is not a researcher, is a finance partner in the Welsh Health Specialised Services Committee, working with SAIL, and they're commended for the work they've done using a value-based approach to looking at activity and costs across a condition pathway, showing that specialist interventions with high value returns can be protected even in the kind of challenging financial environment that we have, and highlighting just what you can do with existing data in a secure data environment. I said earlier, SAIL is one of the real Welsh assets in the health and care research space. And the second highly commended is Victoria Shepherd, who's at Cardiff University, for the Impaired Capacity to Consent Framework Development Group, with their work with researchers and people living with capacity-affecting conditions and carers across the UK. They developed the NHR Include Impaired Capacity to Consent Framework to help researchers to design trials that include this underserved group and to deal with all those really tricky issues that many researchers will back away from around consent for people who have impaired capacity. And it's now been incorporated into national and international guidance for researchers. So those are our two highly commended. The winner is Dr. Marlise Pullman, who's from the North Wales Centre for Primary Care Research at Bangor University. And the judging panel said about this project it's the palliative medicine and the CARIAD team, said about this project, the impact of this work is really important, especially for rural areas such as Wales. Reducing the waiting time for symptom control from 105 minutes to 10 minutes demonstrates this. It had a huge impact on carers looking after their loved ones and the care their loved ones received. It's a great example of a holistic approach to end-of-life care. So Marlise is not able to attend, but I think Julia Hiscock is going to come down and pick up the award on her behalf. So Julia, please do come down. We'll give some applause, and we've got a short video as well.
In the UK, most people wish for their dying days to be peaceful and at home. One way of making this happen is to train family members or friends of a dying person to give as needed medicines, even if their loved one is too weak to swallow pills. This means not having to wait for a doctor or nurse to arrive to give an injection. The new practice we implemented is making a real difference to the people of North Wales. Symptoms are treated much quicker, with waits down from 105 to 10 minutes, meaning patients can be more sure that they can stay at home. Carers feel empowered and value the opportunity to support a loved one this way. I shall leave the last word to Mark.
When my mum was feeling sick and was in pain, I could administer that on my brother, and you could see the difference within the half an hour. And that was so nice for me and my dad to see, and my brother, that my mum was getting the best care that we could give her.
One of the things I said at the start of today was that I think I'm most proud of is the work we've done on research careers and bringing people into Wales to pursue a research career and enabling them to have a fruitful research career in Wales, often working across both academia and the NHS and social care. And so I'm really pleased that now we have a Rising Star Award, and you always worry with a Rising Star Award that it might end up as a sort of badge around somebody's neck. But on the whole, I think our choices in the past have been absolutely fantastic. And the purpose, I think, of the Rising Star Award is to recognise people who are in the early stages of their health and social care career and who are already making a really great contribution in their field. So before I announce the winner, I have got a couple of highly commended examples that I do want to mention. So the judging panel commended Adam Williams, who works at the Centre for Trials Research at Cardiff University, and said he's demonstrated hard work and enthusiasm which has enabled him to really develop his expertise, which is in sexual health research, in a very short time period, with clear plans for his progression as a future research leader. We're looking forward to seeing where he takes this next. And the panel also gave a highly commended award to Helen Munro, who works at Hirondar University Health Board as a consultant in community sexual and reproductive health care. And they said, we congratulate Helen, who's developed her research career in a much needed area of women's health and reducing inequalities in access and outcomes, with a particular focus on underrepresented groups in her research, and has done that all alongside her clinical work. She had a Health and Care Research Wales Research Time Award and further collaborations to build a portfolio of research across Wales. So those were our two highly commended, but the winner is David Bosanquet, who was on our stage earlier, who's a consultant vascular surgeon at South East Wales Vascular Network and our Invervan University Health Board. And the panel said this: you will have seen him present or some of you will have seen him present the research on amputations earlier. The judging panel said this: clear evidence of someone who's really navigated and progressed research in his field of vascular surgery alongside his clinical career. His leadership and collaboration with both the research community and public involvement has resulted in real benefits to patients. And the committee noted and commended the way he'd used his initial investment from a Research Time Award from Health and Care Research Wales, and then a Research for Patient Public Benefit Award, and had gone from strength to strength, now coming to the point where he's leading as a chief investigator for a major NIHR-funded trial and for UK research in Wales. So we're going to watch a short video whilst David comes down to the panel, but should give him some applause.
Hello, my name's David Bosanquet. I'm a consultant vascular surgeon and honorary senior lecturer at the South East Wales Vascular Network. I started my consultant post in 2019 and shortly after was awarded Healthcare Research Wales Research Time Award, which afforded me time to pursue my research interests. In 2020, I was awarded an RFPBB funding for Perceive, a study looking at shared decision making and risk prediction at the time of major lower limb amputation surgery. In 2022, I was successful in obtaining NIHR HTA funding for a 650 patient randomized controlled trial placement, which is trying to reduce pain after amputation surgery. Both studies are supported by the Centre for Trials Research. Established amputees have been integral in both of these research projects, and due to their direct input into placement, every single one of the 650 patients recruited will be informed about the Limbless Association national charity and their free peer-to-peer support program.
And I think one of the challenges for us in Health and Care Research Wales is to make sure that there are more opportunities for there to be more people like David who pursue a clinical career alongside an academic career, whether they are doctors or nurses or therapists or come from other professional groups, but to find that sweet spot where you enable people to both remain in their clinical practice because they love it, and yet also to be active researchers working with higher education institutions. And that's very much part of what Monica Bussi, who is unwell and not able to be here today, but what she's doing in directing the faculty. I'm coming now to the two awards that you have chosen. The People's Voice has been expressed at up to lunchtime, and people have voted for the Best Poster Award and for the Best Stand Award. So, thank you to everybody who submitted posters and abstracts and so on. We've had some a great quality ones on display, and I'm going to announce third and second place, and then come to the winner and ask them to actually come down and pick up their award. So, third place goes to Gabrielle Brotto, Knowledge Exchange and Shared Learning, demonstrating enthusiasm for research across the UK. Second place goes to Michaela James, Embedding Co-Production in Research. And the winner of the Best Poster Award this year is Kendall Xanthe for the All Wales Research Delivery in Pre-Hospital Emergency Care. So Kendall, are you able to come down and pick up your award? And all good things have to come to an end, so I think I now come to the final award, which is for the stands. And the exhibition, if you had a chance to look around, it had all sorts of really great stands, and lots of imagination and creativity had gone into the things they were doing on stands, not just standing, as you know, understand, but making them really engaging. And the close second on this occasion, but not the winner, was actually last year's winner, CADA, the Centre for Ageing and Dementia Research. But the winning stand was Cwmtath Morgannwg University Health Board's R&D department. Oh. So please come and collect your award. I think that I'm going to treasure that reaction. And I'm going to hand back, I think, to Owain.